For years, Tony was the picture of health until one day a mysterious condition turned his life completely upside down.
After I graduated from high school, I had gotten a really nice job. I was just starting up in a band. One night I get home and I noticed I had rings on my forearms. Dermatologist started everything from blood work to biopsy. During the middle of looking into all the blood work, everything disappeared from my forearms and went completely to my calves and my feet. This red bump turned into many bumps. Started becoming pussy. Doctors took one look at it, said that I had a staph infection. That's when everything just went crazy. I have multiple ulcers all over my feet. The skin starts to tear. It was 100% of the time, 24/7, no stopping pain. One time things got so bad, I actually collapsed on the stairs. The dermatologist had put me on a lot of medicine. I went from being on steroids and painkillers and the blood thinners. My parents and I were worried if we would ever need to amputate both of my feet. I was worried that I was going to die. It was just pure agony all the time. My whole life I had perfect teeth. One day I noticed that there was a chip in my two front teeth, right down the middle. And then I noticed that my teeth would become rubbery. I was able to push pretty far back on one of the teeth and it just cracked. When I went to the dentist, they told me that I had enamel issues. And that's when I knew that the years of taking all of these different medications had started rotting my teeth. I don't look myself in the mirror anymore. I had lost my top row of teeth and then most of the bottom row. I don't. Yeah. That killed my self-esteem. I thought to myself I would be alone for the rest of my life. The disease and the way that I look, how can you kiss this? And then I met Charlene.
I met Tony online, and I work at a veterinary clinic, and Tony asked me a question about his dog.
It was love at first sight for me.
When I first saw him, I'm like, oh, he's on it. I didn't even notice in the beginning that he was missing any of his teeth.
She's my bright star. She brought me back out into the world, giving me self-esteem, giving me love.
No matter what happens to him, you know, teeth, no teeth, legs or no legs, I absolutely love him.
I want to marry her, but I don't want my proposal to be with how I am now. I want to be able to smile at her. I want to be able to show her my real smile.
The medications Tony took to ease years of intense pain may have directly caused his extreme tooth loss, so we sent him to celebrity dentist Dr. Karash Maddahi and board-certified maxillofacial surgeon Dr. Parvaz Mizrahi to see if there's anything that might be able to be done.
When I look at the x-ray, all of the roots of the teeth are there. The rest of them are broken down due to severe decay.
When I had seen a dentist, he actually said, oh yeah, you have meth mouth.
Yeah.
And I looked at him and I was like, I've never done recreational drugs. I don't play around with that. I don't even drink.
The unfortunate fact with Anthony is that he's not a drug addict, yet he has a meth mouth. Taking narcotics day after day and then did higher and higher dosages of these narcotics over the years just attack the tooth structure. Tooth number 1 is all fully decayed and broken down. Tooth number 2, number 3, number 4, number 5, 11, number 12, number 13, number 19, 20, 23, 24. Okay, you can see little shadows underneath the root surfaces, right? These shadows are infection.
Wow, I don't feel anything.
As the enamel wore away, the nerves got exposed and the nerves died. That's why you may not have so much pain right now. So now we have bone infection, bone destruction, tooth infection everywhere. That makes it even more complicated.
Yeah, I can't believe that's my mouth. Yeah.
We need to also get help of an oral surgeon.
Open for me this time. Okay, and that closed down.
Tony has a lot of irreversible damage that has been done in his mouth.
Pain here?
No.
No. See how the bottom teeth touch the upper lip? He's very deficient in this area.
The bone is recessed and is pretty much gone, but also he doesn't have a good quality of the bone.
This is one of the worst cases I've ever seen, in the sense that there's so much infection, all the teeth are broken, and then he has all of this medical condition on top of it.
Please welcome Tony and his girlfriend, Charlene, to our show.
Thank you.
And I'd like to welcome Dr. Maddahi, as well as maxillofacial surgeon Dr. Mizrahi, because the twist in this is that he had so many issues orally, infections developing without being addressed. This could have actually killed Tony.
That's right, Travis. Tony's case is much more complicated and severe than I ever thought it was initially. When I initially saw his pictures, I saw just a bunch of broken teeth. And then when he came to my office and we took the scan, we saw pretty much 32 broken teeth, all infected. The infection is growing into the bone, into the sinus, getting close to the nerves of the jaw. So normally, when we're dealing with a case like Tony, we're seeing the infection, and as dentists and oral surgeons, we're trying to actually treat the infection. In his case, treating him also could be fatal. His medical condition exposes him to have blood clots. And because of the blood clots, what happens is that during surgery, he could have blood clot that would cause heart attack, stroke, or even pulmonary embolisms. So we are in a stage where we are thinking, if we don't treat him, it can be fatal. If we treat him, it would be fatal. So we had to enlist the help of multiple specialists in order to figure out what would be the best route in terms of doing Tony's case. And I can't stress how lucky you are you wrote into the show when you did.
Thank you very much. I never would have known.
So you two have seen his case. Is there hope?
Luckily, I'm here to tell you, Tony, both Dr. Mizrahi and I are confident that we can safely treat you and get you out of this problem and give you back your smile and your teeth that you had.
Oh, my God. Thank you so much, guys. Thank you so much. Both of you, thank you so much.
And it's all going to be free of charge to you.
And I want to say this is a surgery involving so many different specialists that can cost well over $100,000. So thank you.
Oh my gosh, yes, thank you very much, everybody. Thank you so much.
And I just want to get one quick word from Dr. Mizrahi, because to emphasize, this is going to end up being really a big-time team approach, is it not?
It is true. And you know, as an oral surgeon, I've seen many, many mouths like this. Unfortunately, most of them are with drug abusers and what we call a meth mouth. With Tony, he's never abused drugs in his life, and it's very unfortunate that he has this condition because of the chronic use of narcotics and the medication that he's been on. So this is definitely going to be a very, very challenging case, but it's not impossible.
Well, we cannot wait to follow alongside. Thank you both so very much. Tony and Charlene, thank you for reaching out, because I am really excited. I know all of our producers, everyone in our audience, everyone watching at home, we cannot wait to bring you back on this stage and show the world your beautiful smile. And more than anything, to kiss this woman that you love on this stage, because you deserve this.
Thank you very much. Thank you so much.
Be right back.